So what's the problem? When we see a group of children, even these very young children, in the primary dentition, we can see the early signs of orthodontic problems. Here we have children who have crowded teeth, open bites, but in particular in the background we can see that we have an underlying mouth breathing problem and underlying functional problem. So we can see the children with mouth breathing problems both have gummy smiles, so the maxilla is growing vertically, not horizontally, and they almost certainly have some form of sleep disorder breathing. And when you ask parents, how does your child sleep at night? Are they restless? Do they have problems? They can't believe that you know this because the signs are there already. And the two children with reverse swallow, they have nice little dimples, but in fact that's dysfunctional. So we see the signs of the early malocclusion in these children, but it's also a sign that they have some health problems. So we look more closely. These children cannot possibly develop correctly. They've got crowded teeth in the primary dentition. There should be spacing, so they must have an orthodontic problem. But now they have an underlying medical problem, and that is children have mouth breathing, narrow jaws, and that leads to sleep disorder breathing in the future. And so we now can relate that to the problems that the children have. And if you see this child is developing an open bite, we say, oh, well, okay, we'll sort that out later on. But his craniofacial growth is going vertically because of his mouth breathing problem. So that's what we're looking at, the health issues. Now more and more, paediatric orthodontics is all about spotting sleep disorder breathing in children. It's become a big issue in the medical profession, and now they're throwing it over to the dental profession to sort this problem out. MRC has been correcting mouth breathing problems and sleep disorder problems with children for the last 25 years, but we've been looking at the dental effects primarily, the growth and development effects, but it's much more to do with the overall health of the child, and the medical profession is throwing it to us to sort this problem out. So not only do we see early malocclusion, we're seeing early health problems, and the nice thing is we've got the system already that we've developed over a long period of time to resolve the issue. Problem with current orthodontics, we know now you get enamel damage with brackets. We know we get root damage most of the time. The work by Professor Darrendyler in Sydney University has noted that most cases up to 100% get root resorption. And we also know that one of the biggest issues in orthodontics now is relapse. The recommendation now, we have to bond these teeth in forever. We have to retain them forever, otherwise we know they'll relapse. So that's just the research that's around at the moment. And so we know that we've got to do something better. Parents are getting wise to this and saying, I want something better for my child. I don't necessarily want them to be wearing retainers for life, and I don't want them to have damaged teeth. Clearly we've gone out of the extraction stage, so parents don't want extractions, so it's much more to do with looking at the causes. And now we need to come up with a system, which we have developed over 25 years, of looking at the causes. If you can see what's going wrong with the child, if you can show the parent what's wrong with the child, and you can relate it to some health issues, the parents always accept treatment. So if we take Caitlin here, for instance, she's got extremely crowded lower teeth, but that's a symptom of the problem. And she's mouth breathing. When she breathes through her mouth, her growth is vertical, there's less room for the teeth. And in addition to this, the mouth breathing causes her to be tired in the morning, so she's got some form of mild sleep disorder breathing. So these things all fit together. The problem in the past, we just said, oh, let's just extract teeth and that'll be okay. Well, we can get a nice dental result here, but the rest of the problems haven't been corrected. And here we see Caitlin after 9 months of treatment with the MyoBrace, and she's completely changed. This is what impresses parents. The change they get in their children, not so much because of the appliance, it's because we've changed motor breathing, we've changed their direction of growth, and obviously then we've made more room for their teeth. And you can see every time the children come in, we put them in front of the mirror, we make them understand what the problem is and that they're the solution to the problem. So everything's changed after this period of time, and the nice thing is after 9 months, 12 months, 18 months, the children continue to improve their craniofacial growth and their health, and that's what's reported to us by the parents. So this is our diagnostic system. Most of you can do the left-hand side. We can evaluate dental alignment, arch form, occlusion, and facial development. What you're not so good at is looking at mouth breathing and evaluating tongue position, swallowing patterns, and lip function. That's what we teach you in the course, how to recognise these issues and how they're directly related together. They actually, arch form is directly related to tongue position, arch form and occlusion is directly related to mouth breathing and posture. So here we see this child, she's a mouth breather, and we primarily diagnose from the soft tissue dysfunction, not the fact that she's a Class 2 Division 1 anymore. So we look at facial growth. How does a child grow? Downwards and forwards is normal growth. When there's correct downwards and forwards growth, most of it's horizontal, and there's plenty of room for the anterior teeth and the posterior teeth. What happens when you're a mouth breather? All the studies show the growth goes vertical and also back, so there's less room for the front teeth and also the wisdom teeth coming through. This is a good illustration of how much space is missing, and also a good illustration of when we change mode of breathing, how much extra space we have for the teeth, and obviously also, like you saw in Caitlin, how much better the teeth look, how much better the face looks. And if you have a reverse swallow, most of the time if you are mouth breathing, you'll have a reverse swallow, but some children just have an adaptive reverse swallow. The same thing happens. The swallow is against the direction of growth, and we have less room for the teeth. Reverse that process, we've got plenty of room for the teeth, and the face develops the way it should be. This is the most important thing. We're not making things grow. We're allowing the children to grow to their genetic potential because we're taking away the habits that are limiting that genetic potential. So, quick look at the appliances. This video pretty much explains it all. There's also a comprehensive website that shows you which appliance to use and more about the application of the appliances.
The MyoBrace appliance range is an advanced myofunctional orthodontic system, intelligently structured for a clearer approach to appliance selection. The appliances incorporate cutting-edge design characteristics that are unrivaled by competitors, taking orthodontic treatment to a whole new level. For the clearest approach to appliance selection, the MyoBrace system uses familiar classifications to separate each appliance group. These groups are MyoBrace for juniors, MyoBrace for kids, MyoBrace for teens, and MyoBrace for adults, representing the primary, early mixed, late mixed, and permanent dentition stages. In addition to these main appliance groups, there is a specialty group, MyoBrace Interceptive Class 3, that offers treatment solutions for more specific cases, displaying Class 3 malocclusion. There is also the MyoBrace for arch development, which provides treatment solutions for cases which require increased arch development in combination with MRC's appliances. To further simplify appliance selection, each appliance group generally consists of 3 appliances covering 3 stages of treatment. Each stage clearly outlines the appliance's purpose during a specific stage of treatment. The treatment stages are as follows. Stage 1, habit correction. Stage 2, arch development. And Stage 3, final alignment and retention. The MyoBrace for teens is the only exception to this format. It has a separate dental alignment stage, making it a 4-stage appliance group. With an understanding of the appliance groups and stages, the appliance names will make perfect sense. Each individual appliance name directly corresponds to both the appliance group and the stage within the group. For example, the MyoBrace for kids appliances are named K1, K2, and K3. Another example is the MyoBrace for teens, which uses a 4-stage appliance sequence and are named T1, T2, T3, and T4. This naming style applies for the majority of appliances within the MyoBrace range. There are many new and some existing appliances that make up the MyoBrace system. There are 4 main appliance groups that directly relate to the dentition, and 2 appliance groups which provide more specialized treatment. MyoBrace for Juniors is a 3-stage appliance system for the primary dentition: J1, J2, and J3, incorporating fundamental design characteristics based on its predecessor, the infant trainer. Advancements to the design features have been developed specifically for habit correction in young children. MyoBrace for Kids for the mixed dentition is made up of the K1, K2, and K3. The K1 and K2 appliances were formerly named the I2N and the I2, MRC's most advanced myofunctional appliances. The K3 is a newly developed appliance used for final alignment and retention. This incorporates MRC's new tongue tag development, which allows for better tongue position in the final alignment stage of treatment. MyoBrace for Teens consists of a 4-stage appliance sequence with features that actively develop the arch form and align the teeth as the permanent dentition is developing. The T1 and T2 are used to correct the poor myofunctional habits and develop the arch form, while the T3, formerly the MyoBrace Regular, features both tooth slots and actively works to align the teeth. Final retention is achieved with the T4, a new appliance featuring MRC's new tongue tag development for better tongue position in the final alignment stage of treatment. MyoBrace for Adults is designed specifically for the permanent dentition. The A1, A2, and A3 make up the 3-stage appliance group that incorporates many of MRC's proven design principles, including features that correct poor oral habits, along with other newly adapted design characteristics to treat malocclusion in adults. MyoBrace Interceptive Class 3 is a specialty appliance range which features design characteristics unique to the correction of Class 3 malocclusion in the mixed dentition. The I3N and I3, formerly part of the Interceptive series, remain unchanged. The newly developed I3H is used in the final stages of treatment for alignment and retention, and features MRC's new tongue tag development for better tongue position in the final alignment stage of treatment. MyoBrace for Arch Development is a range of appliances designed to provide treatment solutions for cases that require increased arch development in combination with MRC's appliances. The bent wire system, or BWS, is now categorized into this system and is joined by the BioBlock and MRC's new composite build-up technique, MyoLay, which assists in realigning the jaws and the occlusion. MRC's new range of MyoBrace appliances are accompanied by educational materials that support treatment, including new websites that offer special features not seen in the industry before. MRC's website, myoresearch.com, features an appliance selector which allows users to enter patient characteristics and receive insight and assistance on matching an appropriate appliance or sequence of appliance to an individual patient's needs. Whether you're new to myofunctional orthodontics or you are already familiar with MRC's appliances, MyoBrace allows for effective appliance selection and improved treatment outcomes.
The MyoBrace for Braces series is the newest addition to MRC's MyoBrace appliance range. The 4-brace series is designed for use with either regular or lingual braces and incorporates 3 treatment stages: the B1 for habit correction, B2 for arch expansion, and the B3 for habit correction in the retention phase with clear aligners. To learn more about this advanced myofunctional orthodontic system, visit our website, myoresearch.com, and attend a seminar.
So this is the appliance range. It doesn't go on occlusion, it goes more on the age of the patient. So the younger they are, the smaller the appliance is, the older they are, the appliances just get longer, and they've got more features for arch expansion in the appliances for the older patients. And it's all about this guy, the big guy with 500 grams is a tongue. It's all about controlling the tongue position. And when you come to an MRC course, you'll learn much more about how important it is to get correct tongue position and lip function, because only takes a slight amount of force to move a tooth, but in fact the lips and the tongue have much greater force to move teeth and actually reshape the bone. So that's what we're working with. Again, I said there's an appliance selector on the website, so don't get too carried away with the appliances, but you do need to understand what they're all about, what the stage of the appliances are. The MyoBrace appliance system is really a 3 to 4 stage system, and it's all about primarily habit correction, correcting mouth breathing and incorrect swallowing pattern, arch development. We need to have the upper arch wide enough so the tongue can get up in there. So it's habit correction, arch development, dental alignment, and then retention. So those 4 phases are built into all the appliances. The appliance that you'll use most of the time will be either the K series or the T series, and the K has 3 phases, the T series has 4 phases. Learn more about that when you come to a course. So research, how does it work? So I like these small number of studies, in particular the European Journal of Orthodontics study 2011 showed that the trainer system and the MyoBrace system correct function. That's what it's all about. So what do they correct? They primarily correct motor breathing. This Japanese study has a very good section on how mouth breathing is so detrimental to craniofacial growth and how the trainer system has worked to correct that craniofacial growth. And most importantly, that study also showed it's in an orthodontic practice, and they showed there was much less need for braces. Now that scares some orthodontists, but really you're providing a service. And why do we need to put braces on and put permanent retainers on? Because we really haven't resolved the problem in the first place. So parents prefer to have the problem resolved. And it's all about correcting function. And I always like to say it's an endogenous technique. Really, the child is doing most of the work. You need to get the child changing function. You need to get the cooperation of the child. When they do, everything changes. So look at myoresearch.com, and it's got pretty much all of it in there. So as I said, key to this is parent education and child education. First of all, doctors say, how can I convince the parent to have this? Well, we have a very good presentation CD. It takes about 20 minutes to present to any parent, and at the end of that, if you and your staff do this correctly, you'll almost always get acceptance of the treatment. And it's all about making it work in your practice. And this is not just putting a few appliances in and hoping for the best. We have a complete system, how your staff manage a lot of these procedures, and it's all on video, and you can learn all this at one of our courses. The most important thing is to understand that it's a system that once in your practice, it works. Why does it work? I think the biggest change we've had in the past 5 to 6 years is introducing the trainer activities, and now we've also modified the trainer activities, made them all animated. Now they're called MyoBrace activities, and this is an example how we get the message across not only to the parents but also to the children.
Hi there, my name is Andrea.
And I'm Ben.
And today we're going to learn about some fun ways to help you get straight teeth and grow your jaws.
These are simple, fun exercises called MyoBrace activities. And to make sure you get the most out of the MyoBrace your doctor has recommended, you should do them every day.
Today we're going to explain how completing these activities every day, as well as wearing your MyoBrace, will help your teeth and jaws develop the way they should.
So why don't we get started learning about the activities? We now know that when we start to see signs of crooked teeth, it usually means the jaws aren't growing properly. Bad oral habits, like not swallowing the right way and breathing through your mouth, are the main causes of the crooked teeth and jaws. The forces of the tongue, cheeks, and lips combined with these bad oral habits can have a big effect on how your teeth are positioned, as well as how your jaws grow. A normal top jaw grows properly because the tongue rests in the correct position, which is in the roof of your mouth, known as the correct tongue resting position. If your tongue does not rest in the roof of your mouth, the top jaw will become too narrow, so teeth won't have enough room to grow straight.
Another thing to watch out for is if you're swallowing the wrong way, with lots of movement in the bottom lip. When this happens, your front teeth will be pushed backwards, and this also causes your teeth to be crowded. Your MyoBrace, as well as the MyoBrace activities we're going to talk about, will help you fix those bad habits so your teeth and jaws can grow the right way. If you have a look at this boy, you can see what happens when we change from an incorrect tongue position to the correct tongue position. Once those bad habits have been changed, you can notice the difference straight away. So, how does your MyoBrace work? The MyoBrace appliances work by teaching your tongue to rest in the correct tongue resting position. Breathe through your nose normally and swallow the right way.
MyoBrace activities help this by stretching, strengthening, and retraining your tongue, lip, and cheek muscles, as well as improving the way you breathe. If you can control where your tongue is positioned and the way you breathe, then your treatment time will be shorter, your teeth will naturally become straighter, and your jaws will develop the right way.
The MyoBrace is a very important part of your treatment, and it needs to be worn every day for 1 to 2 hours and overnight while you're asleep. You can wear it while you're getting ready for school, doing homework,
playing games, or even while you're watching TV. It can't straighten your teeth all by itself though, so it's important we help the MyoBrace do its job by completing certain tongue, mouth, and breathing activities. If you're wearing your MyoBrace as well as completing the MyoBrace activities every single day, you'll be on the fast track to making your teeth and jaws grow correctly.
A good way to remember you need to do your activities is to place MyoBrace activity stickers around the house. Then when you see them, you'll be reminded to complete an activity. Now, we are going to show you how to use your MyoBrace. Step 1. Hold the MyoBrace with the tongue tag facing upwards. Step 2. Place the MyoBrace into your mouth. Step 3. Position your tongue on the tongue tag and make sure it stays there. Step 4. Close your teeth down on the MyoBrace, and you should feel it working to straighten your front teeth as well as your jaws. Do not chew on your MyoBrace. Step 5. Keep your lips together and breathe through your nose.
The activities have been broken up into groups, and you should do the exercises in one group before moving on to the next, unless you are told otherwise. You need to do each of your activities 2 times a day for a minimum of 2 minutes, and combine this with wearing your MyoBrace. A good time to do the activities could be before school and then when you get home again. You may need a few items before starting, so make sure to check each activity for anything extra you might need. Be sure to use your MyoBrace app or workbook to keep a record of your progress.
It's important for you to watch yourself in a mirror while practicing your activities so you can be sure you're doing them the right way. One thing you need to remember is muscles are very smart and they even have memories, so they will remember when you teach them new things. You need to make sure you do your exercises the right way, because if they are done incorrectly, your muscles will remember and they won't improve.
Body posture is also very important for your overall health and development. When you're practicing your activities, whether you're standing, sitting, or laying down, make sure to keep as straight as possible with your shoulders and head back. When sitting in a chair or standing, your feet should be flat on the floor.
So what are we trying to achieve by doing these activities? We need to set some end goals, so let's keep them simple and they will be easy for you to remember. Your main goals are to breathe through your nose, Keep your tongue in the correct tongue resting position. Swallow correctly. And keep your lips together all the time unless you're speaking or eating.
If you want your teeth to be straighter and your jaws to grow the right way, you need to be prepared to put in the effort and do your MyoBrace activities every day. Remember, those bad habits didn't appear overnight, so it may take time to train new ones.
By working hard and altering bad oral habits, you will get great results. But it's up to you to make the change. If you want to know more, you can talk to your MyoBrace educator or check out myobrace.com.
Now we're ready to start your activities.
And you can see, really, this explains it in a very child-friendly way. The MyoBrace activities are now part of the MyoBrace membership and MyoBrace Certified Provider Program. The earlier version, which is the trainer activities, available in a small kit, which, Doctor, we can show you how all that works. This is how we've developed things the last 6 to 7 years, and it's all about talking to the children, not one-to-one verbally, but putting them in front of a screen. This is where they learn everything these days. And now with the animated new app, which is can be used on any device, the children directly get the information the way they're used to getting information in the 21st century. I mentioned about the education CD. I'll just go through this quickly. This is very easy to use. It's all menued. You can have a presentation, either 10 to 20 minutes, to the parent and to the child to make them understand why they need this treatment. So it's got a short video which explains pretty much everything, so you show that first. This makes the child and the parent understand that the tongue is the big player in this problem, and the tongue just cannot function correctly if your child's breathing through the mouth. Really, what does orthodontics do? It doesn't really resolve the issue. It's still okay to put braces on, but if we put braces on and do nothing else, not only aren't we going to get a stable result, we're also ignoring some of the health issues, which is in particular now the possible sleep disorder breathing, the possible TMJ issues. So we really need to correct the overall problem. And most parents who've had orthodontics understand that orthodontics is detrimental to their children's health. So the causes are mouth breathing and incorrect swallowing pattern. You can show them the videos that I just showed, and then parents are alarmed that their child is getting incorrect growth in a vertical direction rather than a horizontal direction. So the crowded teeth is just a symptom of the overall problem. So we come to clinical application. What are we doing this for? It's not just about aligning teeth. It's about health, but also we find that we can get orthodontic results that are very, very difficult to achieve just with fixed appliances. So here we have a completely different age groups. We have a young child, 4 years of age, and just by changing mode of breathing, using the MyoBrace within a few months, you can see that everything has changed. Particularly, you can see that the lips and the mandible and the soft tissue is starting to be normal. In the previous shot, there's quite a bit of retrusion of the maxilla and the mandible, and clearly an open bite, and that's because she's mouth breathing and she's swallowing incorrectly. And this other case, which is an older child, 12 years of age, you can see very poor craniofacial growth. This is just an example of what changes. Well, it changes everything. By changing mode of breathing in particular, you get better craniofacial growth, but you also can get complete class 2 correction. So the dental side and the facial side and the health side are all addressed by this system. Now here's a good example of what we're talking about. It's a case that I treated quite a while ago. Twins look completely different. Why are they different? Because one has health issues, the other doesn't. And what we were able to do using the MyoBrace system, we're able to develop these children to their genetic potential. This is not introducing something that they shouldn't have had in the first place. And you can see now these identical twins are now identical. And that's because we've gotten rid of the mouth breathing incorrect swallowing pattern, and also, by the way, we've aligned the teeth. So if you explain this to any parent, this is what they want for their children. We teach you how to explain this. Most of the information that I've overlined to you now is on the web.
MRC is dedicated to providing education and support for the professionals who purchase appliances and their patients who are treated using these appliances. MRC has redesigned myobrace.com and myoresearch.com, websites that provide information and education for professionals and their patients, and also for members of the general public interested in learning more about treatment options using MyoBrace. Myobrace.com. Myobrace.com was built specifically to help members of the general public better understand MyoBrace treatment. This website allows users to gain a clear insight into myofunctional orthodontic treatment options. It is also a comprehensive tool for professionals needing a more efficient way of educating parents and patients on myofunctional orthodontics and MyoBrace treatment. Patients are able to learn how the treatment works and why MyoBrace is a viable alternative to traditional orthodontic treatment with braces. The site allows users to perform a self-assessment in order to better understand if treatment is suitable for their needs, and also directs users to the nearest MyoBrace certified providers, using the website's Find Your Practitioner feature. Save time when patients ask about MyoBrace treatment. Direct them to myobrace.com. If you'd like to learn more about the MyoBrace Certified Provider Program and how you can be listed on myobrace.com's Find Your Practitioner feature, please contact your nearest MRC representative. Myoresearch.com has been rebuilt from the ground up and offers features not seen in the industry before. This is part of MRC's ongoing dedication to providing professionals with effective education and training resources to accompany a comprehensive range of appliances. The Myofunctional Orthodontics section provides information on a range of topics, including the research behind myofunctional orthodontics, and provides advice on how best to implement these treatment methods into any practice. The section also assists professionals to better diagnose and treat patients using myofunctional orthodontic techniques. The Appliance Selector feature, built into the site, allows users to enter patient and treatment characteristics and receive insight and assistance on matching an appropriate appliance or sequence of appliances to an individual patient's needs. This feature has not previously been offered in the dental or orthodontic industries and will prove a valuable reference tool for practitioners. There is also an extensive library of online training programs and resources that gives practitioners the knowledge to confidently perform myofunctional orthodontics more efficiently and achieve better treatment outcomes. The website's Live Assistance feature allows users to interact with MRC sales representatives in real time, providing first-class service to customers. MRC's Tip of the Week features fresh content updated weekly in the form of a concise video that will provide clinical insight into the practical applications of myofunctional orthodontics.
Basically acts directly on the hard tissue.
The forum on myoresearch.com allows practitioners from around the world to share cases, build an international network of contacts, and learn from their peers. The site will be regularly updated with news items, training materials, clinical tips, and insight from leading myofunctional practitioners. The global demand for orthodontics without braces continues to grow. It's an option that many parents and patients would prefer. Myobrace.com and myoresearch.com provide clear information on myofunctional orthodontics and MRC's appliances for both the public and professionals, increasing awareness of myofunctional orthodontics and improving your understanding.
So have a look at what is on myoresearch.com, and then we suggest come along to one of our courses. It's not compulsory. You can get started and start using the appliance system, but you'll find unless you introduce the appliance system exactly as we have designed it, it won't work as effectively and as profitably as you like. So here's a group of doctors in our US office from Brazil, and so we have courses running everywhere. The most important thing is understanding it's about children's health. This is not another orthodontic technique. Here we have in our US office, we get a group of children and we see every child in this group has not only a malocclusion, but they also have the myofunctional issues that we're talking about. So mouth breathing, incorrect posture, incorrect swallowing patterns. And we show you how you can see this at any age. And so when we have our courses, we show you how to present this to both the parent and the child. And it's all about children's communication, but you have to use our educational material to make it effective. Children communicate with a monitor much more than they do with an adult these days. So we've made everything easy for you, put on DVD or on an app, and this is readily accessed by the children. This is just a short video to show you what we do in our courses.
MRC realizes the importance of doctor education.
I'll show you a ton of cases that you will think, I would have thought, probably 20 years ago, were really impossible to treat without extracting teeth.
With a global network of international training facilities, MRC provides dental professionals with an educational experience, facilitated by knowledgeable practitioners, which includes valuable insight into the diagnosis and treatment of malocclusion using MRC's appliances. Our hands-on courses equip you with the ability to treat a wider range of cases and achieve better patient compliance while experiencing increased profitability. Practitioners who attend an MRC course can also gain access to MRC's exclusive online MyoBrace training program. This video training program covers all aspects of treating patients using myofunctional orthodontic techniques and the MyoBrace system. Designed specifically for doctors and staff, the program details everything from clinical procedures, live demonstrations, and patient education. The program is also a great introduction for doctors wanting to become a MyoBrace certified provider.
And it's all about making it work in your practice. So come along to a seminar. I'll just show you a couple of cases and show you how it works. Amazing enough, at any age. This is early mixed dentition using the trainer and the MyoBrace system. Large anterior open bite, spacing. This all gets closed down, not because the appliances are so effective, but the appliances are correcting mouth breathing and the incorrect swallowing pattern, and so are the MyoBrace activities. And routinely we get this nice broadened arch form because that's the effect of the tongue. So I'll put a few of these cases up. If you want to see a few more of them, come along to a course because we've got lots of them. Even quite severe cases like this get corrected very easily. So I'll just flip through these just to give you an idea. We're not just primarily aligning teeth, but we are correcting malocclusions that are very difficult to correct just with braces alone. Here's a typical example, a large anterior tongue thrust, open bite. You can see the very narrow arch, and that's closed down, but what you see is the effect of the arch form, and that has an effect on the face. We'll show you all that when we come to clinical cases in our course. So you can see typically, even in the very early mixed dentition or in the primary dentition, we're correcting function. We're not trying to get dental alignment, we're correcting function. By correcting function, the teeth, be aware that the malocclusion is an indication of dysfunction and health issues. When you get the teeth correcting by themselves, you know you've corrected these health issues, in particular the mouth breathing. So class 3, always considered a genetic problem. This is a tongue positioning problem, and you can see with our i3 appliances, our specialised i3, MyoBrace i3, you can see we've corrected this within a year or two. Case number 7, I'll get you in our courses to understand, if you look at this arch form, you say that's a mouth breather. So that's the interrelationship that we need to be able to show you what is causing these malocclusions. And the arch form at this age just won't correct by itself, so we will show you how to use the bent wire system and the series of appliances to get a good orthodontic result that is stable. That's the most important thing, and you can see the improvement in arch form. And what amazes doctors is how much we can open the bite and correct class 2 malocclusions, not by having an appliance in there 24 hours a day, but getting the children to correct their habits so the tongue and the lips and the breathing are in there 24 hours a day to correct the problem. So I haven't showed you too many faces because I know you're really focused on the teeth, but what is interesting is the improvement in the face, and that is the mid-face development just by getting the tongue up into the maxilla and getting that horizontal growth working. And this is the case I showed you before. So routinely we're getting better facial development. Why? Because we're correcting mode of breathing. We're getting the tongue up in there. By correcting that mode of breathing, you're getting more oxygen into the brain. And there's a lot of research. There's a whole bunch of changes that are affected by changing mode of breathing. An amazing result for a child in the early permanent dentition. And you can see what's changed. Everything's changed.